hospital has one of the most dynamic environments that an organization can have. In such a highly unpredictable environment, what if there was a centralized system that could monitor and record every single dynamic, a common thread to bind every single entity together? MedMantra is a comprehensive hospital management and information solution that integrates all the functionalities of the hospital. Developed by Tata Consultancy Services, it enables patient-centric healthcare through the use of electronic medical records. The software has a strong clinical focus and supports all functions carried out right from the time a patient gets in touch with the hospital.
The software has given us a very good option of quick registration. Registers the patient with a UHID number, and the patient can move into the doctor's chamber for consultation.
Every patient is given a unique ID linking his medical records and interactions. This provides quick access to patient history and maintains continuity of medical care.
When a patient comes to us, his entire medical records are entered into the system. His previous medical history, his allergies, the drugs he was taking at home. So when I try to initiate a treatment, when I try to prescribe a new drug for the patient, my system tells me whether the drug I'm prescribing is going to interact with any of the previous medications the patient was already on, or whether the patient's previous conditions are going to be aggravated by any of the medications that I'm going to prescribe.
MedMantra interfaces with various devices and applications like packs, auto-analyzers and other lab equipment, saving time and costs.
Since it is integrated with the packs, I don't have to wait for a film to be printed to send it across to the orthopedician or to the emergency room or to the neurosurgeon or to whoever needs it. They can see it online in their chamber or in the ER and start the treatment for the patient.
Doctors and nurses can now work on the move with the help of mobile clinical assistants, or MCAs, that can be integrated with the software.
The MCAs that we use are used at the patient's bedside. There is less scope of doing errors in terms of vital signs and in terms of monitoring of patients.
Through MedMantra, the medication prescribed by the doctor is automatically reflected in the pharmacy department. This ensures that the patient gets the right drug and the right dosage without any errors in communication. The software is very useful in case of emergencies, as the paramedic in the ambulance is now able to communicate the patient's data to the emergency doctor in the hospital. The doctor views the live reports of the patient and past records and makes necessary arrangements for further procedures, saving crucial time.
This software has played a major role in integrating our pre-hospital emergency services with the emergency department. I mean, we get a pre-arrival notification of the patient, we know his background illness, we know whether there is a previous UHID of the hospital, and this makes a huge difference when we are dealing with any patient who comes in with chest pain or shock or out of trauma.
MedMantra also helps in ensuring smooth operations at the hospital by providing visibility on various resources and their demand. It keeps a track of key aspects like inventory management, human resource management, insurance claims, and patient relations. It facilitates bed management, OT scheduling, and queue management for different services provided by the hospital. Apart from the clinical functionality, it also integrates support functions like food and beverage by recording the patient's diet restrictions and by making that data available to the cafeteria.
So all the allergies, likes and dislikes, patient dietary requirements is already there. So it's easier for us to, kind of give in the right thing at the right time.
MedMantra helps in giving a holistic picture to the top management through dashboards. MedMantra can integrate with back-end ERP systems of the hospital and external systems of payers and other partners. It also has the capability of bringing together multiple hospital locations into one seamless network.
8 centers across the city integrated with the bed availability, the resources, the manpower availability at any given time. And this makes us respond to any disaster scenario in a much better manner, because just at the click of the button you have the information across the whole city on your resources.
MedMantra, the one thread that binds every function, every resource and every piece of information in the hospital. MedMantra, a hospital management solution for better healthcare.